I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about physical therapy for a torn ACL. So one of the biggest questions we get asked is, do I get my ACL repaired? And I usually defer to the surgeon on this one. I do offer my opinion. It is a big decision, there's no doubt about it, and it's not something I'm really ready to cover in this video. So it's one of those things where it's a really kind of a very in-depth conversation based on your activity level, based on what you do for a job, or if you're a child, what kind of recreational sports you play. So that question I'm going to table for now because that really isn't what this video is about. But so physical therapy for a torn ACL. So let's say you decide not to get it repaired and you have a torn ACL. What do you have to do in order to get it to your knee to get better again? So what you really have to do is you are missing a ligament. And you're missing the anterior cruciate ligament, and that ligament prevents this bone on the bottom here, your tibia, from sliding forward on this femur. So a lot of times you see this type of injury when somebody goes to cut, all right? If they go to cut and they don't have enough muscle strength to hold it and their ACL is too much, the bone kind of keeps going forward and there's a pop. Of course, you won't actually see any of that happen. It happens all internally, but that's kind of what the ACL does. So what physical therapy does for torn ACL is it's going to retrain the muscles and the ligaments surrounding the knee to act when the ACL can't fire. So if yours is torn, or even if it's partially torn, we do the same rehab, but you do have the benefit of actually having a little bit hanging on. But if it's a full tear, it's really important that you exercise the muscles around it. So first of all, what we want to do is we want to make sure that you have all of the correct muscles working correctly. There's no knots in them, there's no tightness. Most of the times with an ACL tear, unless it was a traumatic ACL tear, like you fell down the stairs or something like that, it's due to muscle imbalances, right? So a lot of times if you're running or you're skiing and you go this way, your knee keeps going that way and the ACL doesn't respond, it's because your hips, your hamstrings, or some things were weak. So we have to identify exactly why you tore your ACL, what happened, what was the weakness, what was the deficiency that caused that non-traumatic tear in that ACL. Again, if you fall down the stairs and you tore your ACL, we get where that came from. So we'll still do the same assessment, but it's a little bit less of a mystery how you tore your ACL. You don't just walk down the street and all of a sudden your ACL tears. That doesn't happen. So, we have to figure out where that issue came from. A lot of times you're going to have a tight IT band, you're going to have a tight hamstring, you're going to have a weak hamstring, you're going to have weak glutes. That puts additional pressure on the knee. A lot of the other videos where I talk about the knee being the hub, the hip and the lower leg and the ankle, those muscles come up and attach right at the knee. So it's it doesn't do a whole lot by itself, but it really connects kind of the hip and the knee. So we need to figure out exactly where that issue is. So when you're talking about PT for an ACL tear, one of the first things we're going to do is we're going to get our hands on you, all right? And you want to have somebody really work out the knots and figure out where those knots are, figure out where the tight spots are in that leg that caused that ACL to tear. And then you're going to figure out the weak spots. So most of the time it's going to be a glute issue. So you're going to have problems with your glute medius, some of your glute muscles, your hamstrings. So some of the exercises that we will often do is, first of all, a single leg stand. And why we do balance is we have to teach your knee how to work without having that ACL, without having one of those ligaments there. And most people don't have good balance to begin with. So it's really important once you're minus a ligament to be able to stand on one leg again. So if you do have a torn ACL and you're debating surgery or whatever, this is kind of one of the easiest things you can start doing at home, is just to single leg balance. Now you can make it a little bit more complicated by closing your eyes, standing on a pillow, things like that. One of my patients actually does it while she brushes her teeth, which is a really good way just to get it out of the way. but it's, you know, find some time in your day just to stand on one leg and do it as often as you can. That's really going to help the muscles and the ligaments work synonymously and be able to make up for the fact that there is that ACL that's torn or that's deficient. Another exercise that we do in physical therapy for the ACL is just hip hikes. So you're just going to start, you're going to keep the leg that doesn't have an ACL straight, all right? And then again, it's a balancing activity, and all you're going to do is hike your hip up and down. Nice and easy, nice and slow, okay? It's not this, okay? You're not bending and straightening your knee. All you're going to do is go up and down, nice and slow, hopefully without wobbling as much as I am. Nice and easy. You want to do about 30 of those, then you can always switch to the other leg. But that's going to help that glute medius, which is actually going to help control your foot, which is then going to help control the pressure on your knee. One of the final things that you can do is strengthen your hamstring. So you can do this by doing a bridge where you push where you're going to lay down and you're just going to push your butt off the floor, okay? Nice and easy. You want to do that one leg at a time, so you're not compensating and using your strong leg and making up for your weak leg. But you can do about 30 of those too. Those are kind of three basic exercises, three physical therapy exercises you can do for your ACL if you have a torn ACL. I have to say though that if you don't correct the trigger points in the muscle, so if you run your finger down this IT bin and you're like, oh, there's a lot of pain there, or you know, if you do it in your hamstring or your gastroc and you're able to feel really, really, really tight points, those are trigger points. Any type of strengthening, any type of balance activity you do is not going to mean anything because of the fact that you are not able to correctly strengthen those muscles because they're either too short or they're too long. So whatever you're working with, you're not working with the correct set of tools, and it's really, you might actually wind up hurting yourself a little bit worse. So it's really important that, you know, it's not all about exercise when you're talking about physical therapy for an ACL tear. It really has to be correcting some of those muscle imbalances manually, having somebody get their hands on you to correct those muscle imbalances and not just do a ton of exercises.